this information of wealth that Taylor is going to present you with. So just to quickly introduce our speaker, our presenter for today is Tayler Louscher. She is a SNAP-Ed educator, and SNAP-Ed is the Supplemental Nutrition Assistant Program. And she works, of course, for Illinois Extension in the northwest part of the state, covering Henry, Mercer, Rock Island, and Stark counties. Her priority program areas include healthy food access, fostering community collaborations, and promoted nutrition and physical activity among SNAP eligible audiences. And with that, I'm going to turn it over to Taylor, and she'll get you all started. Thanks, everyone.
All right, thanks for the introduction, Kamaya. I appreciate it. Hi, everyone. Thank you for joining today's session. Before we get started, I just wanted to go over our objectives for today. So first, we are going to identify organizations and resources to help with food access during disasters. And then second, we will also identify food insecurity and define it. And we will explain the relationship between food insecurity and health outcomes. So to get us started, we are going to look at some viral photos that showcase the impact disasters can have on food access. All right, so if we think back to March of 2020, when the stay-at-home orders were first enacted due to COVID-19, people were panicking and anxious about the amount of food available. I remember going to the grocery store after being sent home, and the shelves were bare. There were a ton of people at the grocery store. And it caused me quite a bit of anxiety. It was really a scary time. So this photo was taken in April of 2020 as part of an effort by the San Antonio Food Bank in Texas. So this was right when the stay-at-home orders were first started. Businesses were shut down and closed. Many people had reduced or no income coming in, and that causes a sense of urgency and panic, right? So the food giveaway was held at a flea market in San Antonio. In normal pre-COVID times, the food bank would distribute enough food for anywhere between 200 and 400 families. And then that day, they served around 10,000 families that showed up. So just a huge difference between pre-COVID and then boom, right when COVID hits. This is a photo of the Circle Food Store taken after Hurricane Katrina in August of 2005 in New Orleans. So as you can see from the photo, this is really a heartbreaking photo to see because you can tell that there are folks trying to access the store by wading through about what looks like waist-deep water. This grocery store was a staple to those who lived in the 7th Ward in New Orleans. So if you lived in that neighborhood, this would probably be one of your only options at the time to access food. The level of food insecurity prior to the hurricane was around 15%, which is a significant amount to begin with. Then following the hurricane, food insecurity went up to 82.5%. And 75% of the residents in the area relied on outside sources for food and beverages. In the week following Hurricane Katrina, 55% of the residents were concerned about where they would access food and water. So bringing it back to a more common natural disaster in Illinois and in the Midwest, we have tornadoes. So this photo was taken in 2018 in central Illinois after a rash of tornadoes hit the area. These series of tornadoes ultimately injured 30 people. If you look closely at the image, the building that is damaged is a food mart, probably where a lot of folks living in that area accessed food. So if you only had one grocery store in your area and it's destroyed, where do you go? So when disasters strike, there are many ways that food and nutrition are affected. The photos we just looked through are helpful examples to show how food access and food security can be impacted during disasters. The impact depends greatly on the duration and size of the disaster. So, for example, if we consider the COVID-19 pandemic, it has been going on for over 2 years and has affected the whole world. If we then compare it to a severe storm, which is, a one-time event, however, the impacts might last a while longer. But overall, it's a shorter impact time and it affects a specific region. So there are differences in how those two disasters would be addressed. Depending on the type of disaster, there can be a disruption in transportation. This can be for folks who are trying to access food or even emergency services trying to bring food into an affected area. So food could potentially be available, but for one reason or another, it isn't able to be accessed until those transportation barriers are overcome. So if we think back to the photo from the tornado in Illinois, this could be maybe a rural part of the state, so it could take longer for food resources to become available to that community. The health and nutrition status of a population prior to event can be an indicator of how well a community might absorb a disaster. So for example, research shows us that higher food insecure areas are more greatly impacted by disasters. When we were looking at the photo from Katrina, we talked about how the food insecurity rate prior to the hurricane was pretty high. So the effort to provide proper food and nutrition must be higher in those areas. And sadly and unfortunately, when we look back at Katrina, the relief efforts had many blunders in reaching the communities that needed it the most. So the ultimate goal of a food aid program is to prevent malnutrition in the population affected by the disaster. So when looking to prevent malnutrition, it's critical to plan for the treatment and management of cases that existed prior to the disaster. So here are some steps that many disaster and hunger relief organizations follow in order to provide food to an affected area by a disaster. So first, immediately provide food where the need is most urgent. So for example, populations that lack the resources to be able to access food, or if there is an area where folks are congregated. So thinking of churches, hospitals, schools, or even community centers. Making an initial estimate of the food needs of that population and taking into account the population characteristics prior to the disaster. Locate and identify food stocks. So whether this is from current food stockpiles located elsewhere, food assistance organizations, or governmental programs. In addition, it's important to take stock of the transportation needs and storage needs and distribution needs that also go along with that. Ensure the safety of locally available food and supplies received. So disasters can bring a variety of risks when we're looking at food safety. How far is the food traveling? Is the food perishable? If so, are there proper cooling or warming modes in place? Then we want to also monitor the food and nutrition situation closely, so that the supply and rationing of food can be modified in keeping up with the changing conditions and needs of the community. And then once all of those processes and steps have been followed, providing food aid to the affected population is next. Disasters happen fast and responses need to be fast. So these steps and decisions need to be made quickly. So when we're thinking about disasters that last for a period of, weeks or even months, and in those affected areas depend exclusively on that food aid, the Pan American Health Organization recommends that rations should provide 1,700 to 2,000 calories per person per day. So we are going to take a look and learn a little bit about some disaster relief organizations. Some of these will look familiar to you. This list is not comprehensive, but we're going to talk about a few organizations that offer support during disasters and how they operate when disaster strikes. All right, so first we have the American Red Cross. It was founded in 1881 by Clara Barton, and then since the 1900s, the American Red Cross provides services to those in need, both to the American Armed Forces and folks affected by disasters. Red Cross staff deploy alongside U.S. military. In addition, they also provide classes on CPR and first aid and swim lessons, and they provide 40% of the blood products in the U.S. And then in regards to disaster relief, the American Red Cross provides many services ranging from shelters, mental health and health services, volunteers to help those affected areas, emergency response vehicles, along with supplies and meals and snacks. In partnership with FEMA, which is the Federal Emergency Management Agency, they have created documents on how to prepare emergency food and water supplies in your own home. And if you attended the session last week, Kristen talked a little bit more in depth about that. So as you can see from the photo, the American Red Cross does provide emergency food sources to folks who are affected by disasters. After a disaster, the Red Cross works with their community networks to provide meals and snacks and water to the affected population. They also they provide these services not only in their temporary shelters, but they also have mobile units that provide services in those most affected neighborhoods. And if you visit their website, or if your area has been affected by a disaster and you're needing assistance, there's a Get Help icon on their website. And then from there, you can get connected to your local Red Cross to find open shelters, and also just find individualized assistance if it's needed. So next up, we have the Salvation Army. So Salvation Army was founded in 1900. So it was founded after a hurricane hit in Texas, and it killed thousands of people. So the national commander at the time rallied volunteers to assist in feeding and providing shelter for those folks who were displaced due to the hurricane. So not only does the Salvation Army provide tangible items like food, water, and shelter, but they also provide emotional and spiritual support after disasters occur. The Salvation Army provides trainings for folks who are interested in becoming disaster volunteers. The Salvation Army Team Emergency Radio Network, which is also known as Saturn, is a worldwide network of volunteers who are called upon in times of emergency following a disaster event. So this photo right here shows the Salvation Army serving folks in the southern part of the US in response to a series of hurricanes that affected the area. So the units like this one on the slide provide food and shelter and care to those impacted by disaster. And then as we can see, this is a mobile unit, so likely they figured out where the area with the highest need was, and they traveled to them to provide services to make it easier on those affected. And then to get connected, you can visit the Salvation Army National website and you can enter your zip code. And then from there, you'll be able to find out what services are offered at your local center or the center located nearest to you. All right, so this is Feeding America. Feeding America is the nation's largest hunger relief organization that was started in 1979 to kind of assist in coordinating and assisting food banks that were popping up throughout the US. So they have been providing services to hunger crises for over 40 years by providing food to folks in need by utilizing their network of food banks. Today, there are over 200 food banks throughout the US that are part of the Feeding America network. And then I just wanted to mention too that there are also food banks that aren't part of their network that exist in the US as well. Feeding America assists in hunger relief efforts when folks need it. A part of their effort is how they respond to disasters throughout the US by utilizing their network. And they do it through this following process. So first we have preparedness. Feeding America stores emergency food supplies throughout the country to distribute quickly in the event of a disaster. And then in addition, they have many national partnerships that allow them to have access to equipment and supplies that can be sent to local food banks. And then response. So during a disaster, their nationwide network includes many warehouses and trucks and mobile units. And then when those are deployed, their kind of normal day-to-day services shift to allow them to respond quickly to those affected areas. And then lastly, we have recovery. So member food banks are housed in communities that allow them to have that boots on the ground work. You know, they're right there waiting in the wings just in case a disaster happens. And then this also allows the food bank to stay in the community, you know, to help with the recovery efforts once other agencies could have left the affected area. And then while we're on this slide, I just wanted to add that a disaster doesn't have to be a catastrophic event to need assistance in accessing food. You know, there could be many personal events that could affect a person's need to access resources, like Feeding America's food banks and partner agencies like food pantries. So that's why organizations like this exist, to help folks when they need it. All right, so bringing it to Illinois. Feeding Illinois exists under that Feeding America umbrella that we talked about. So as I mentioned, the Feeding America network has over 200 food banks nationwide. Feeding Illinois' mission is to coordinate and support the efforts of its member food banks and their partners serving those in need. So in Illinois, we have 8 network food banks. So in addition to providing daily services to assist in feeding residents of Illinois who need it, they also have a disaster response that springs into action when a disaster occurs. So as I mentioned, in Illinois, there are 8 food banks that are part of the Feeding America network. Some of these are located in other states, but their service area is partially Illinois. So in Illinois, they are located in Springfield, Urbana, Chicago, Geneva, and Peoria. Those are all located in Illinois. And then we have Davenport, Iowa, St. Louis, Missouri, and Evansville, Indiana. So as I mentioned earlier, there are some food banks that do not fall under that Feeding America network. Midwest Food Bank is a faith-based organization that's mission is to alleviate hunger and malnutrition locally and throughout the world, and by providing disaster relief, all without discrimination. So they are a national organization and have many locations in the US, and they also have locations in Haiti and East Africa. So their locations in Illinois are in Normal, Morton, and Peoria. And then they also have distribution sites in Fairfield, Quincy, and Rock Island. So in addition to providing food through partnerships for pantries and other agencies, they work in providing food during disasters. So they operate by having access to a fleet of trucks and quite a widespread team of volunteer drivers who stand by and they're ready. Food donations are picked up from across the country, which are then kind of delivered to their facilities and then distributed to those affected. Midwest Food Bank is also a supporter of the Salvation Army. So they kind of team up and they can have family food boxes on the road to a disaster site within 24 hours of a request. And then in each food box that a family receives, it can feed a family of 4 for up to 4 to 5 days. And a lot of the items inside the box are shelf-stable items and basic toiletries. And it's just easier to provide that shelf-stable just in case, you know, their power's affected or if they're displaced and they don't have many ways to prepare the food in the box. They provide easy to prepare and shelf-stable items. So now that we have talked about providing food during disasters, we are going to discuss the general framework of the charitable food system in the US and how it serves folks who need it. So when we say the term charitable food system, we're just talking about the US food banking system. So the first line of defense against food insecurity in the United States would be those federal food programs, such as the Supplemental Nutrition Assistance Program, also known as SNAP, and WIC. Oftentimes, these benefits are not enough to meet all the food needs of people living in food insecure households. So another applicable example is with the rising costs of food products and cost of living due to the implications of COVID-19. Folks might not meet the parameters for that federal food program, but they can still access food via the charitable food system by accessing pantries or meal programs. We are all potentially one event take away from needing assistance. So that's okay because the charitable food system is here to provide food when we need it. So the charitable food system starts when food banks receive food or money for food purchases through sources, which includes, you know, individual donors. They can, from food drives, local growers, manufacturers and distributors and retailers. The federal government also does provide food. And then food from the food bank is distributed to partners such as agency meal sites or schools, things like food pantries and meal programs where the food goes directly then to the clients or to the families. Today's charitable food system plays a critical role in supporting the ongoing food needs of food insecure households. You know, more people are exposed to the charitable food system and they're being exposed for longer periods of time. The charitable food system is an important contributor to the food environment and the health of people experiencing food insecurity. So now that we've talked a little bit about how the charitable food system operates, let's take a closer look at how food reaches those who are needing food. So it starts with donations. Food is donated and or purchased from local food companies or through government agencies and food drives and Feeding America. So once the food is accepted, meaning it meets food safety standards, for example, not accepting dented cans or opened packages, items will be picked up by or delivered to food banks. And then to accomplish this, food bank drivers and trucks ensure safe and efficient transportation to the location. And then food banks store and distribute the food. Once the food bank receives a shipment of food, it's then inspected once again, sorted and repackaged for distribution to their partner agencies throughout the food bank service area. Delivery and additional services, partner agencies such as shelters or food pantries receive food from the food bank and then provide food assistance to the guests in need. And then once, the food reaches those in needs, the meals are provided. Looking at the Feeding Illinois network members alone, they fed over 1.4 million hungry people each year, which includes 605,000 children in our state. So now that we have looked at a few of the key players and partners related to food access and hunger relief during an emergency and kind of how they function, we're going to take a look at food insecurity and how it impacts health during times of disaster. All right, so let's start by defining food insecurity and talking in more detail about what it actually is. So the official definition of food insecurity is a lack of consistent access to enough food for an active, healthy life and uncertain availability of nutritionally adequate foods. So think about this question or this definition for just a second. And are there any words or phrases in this definition that stand out to you? Are there any words or phrases that surprise you? So I wanted to highlight some things that kind of stick out to me. So consistent access. So knowing that you will be able to eat food that nourishes your body when you feel that physical hunger. Access during a disaster could take a while, especially if travel to an affected area is not advised. So for example, thinking of the photo of the tornado destruction of the local grocery store, the store is destroyed. There might be a loss of power and downed trees or power lines that make accessing food difficult. Active, healthy life. So we know that some foods, when you eat too much, contribute to chronic diseases that limit our ability to live an active, healthy life. And then nutritionally adequate foods. So not all foods are created equal. Accessing nutritionally adequate foods can be difficult, especially during a disaster when access to fresh produce and other perishable food items might be limited. A lot of the foods and meals provided by food programs will be, easy to prepare and shelf stable. And then in addition, something that we've experienced recently is there might be supply chain issues which prevents certain foods from even being available. And then I wanted to address this sentence at the end where we're talking about hunger and food insecurity are closely related, but not the same. Hunger is that physical feeling we get when our body needs food. It's that physical pain, you can feel it in your stomach, your brain might feel a little fuzzy, your stomach's growling. Food insecurity is not having reliable access to food to make our physical feelings of hunger go away. So there's no way to end the hunger. Disasters can cause disruption to the food supply chain, like we talked about, and communities may experience the closure of food stores, which makes accessing perishable foods nearly impossible. So disasters strongly impact food security. So let's take a look at the 4 levels of food security. Individuals and families with that marginal, so in that yellow area, or high food security are considered food secure. And those with low or very low food security are considered food insecure. So if you look at the graphic, you'll notice that the major difference between those with marginal food security and low food security is the reduction of the household's quality, variety, and desirability of their diets. But the quantity of food intake is not substantially disrupted. So the type of food you have access to also contributes to food insecurity. So the major difference between food secure and food insecure comes down to the quality, variety, and desirability of the food available and whether or not it is consistently available. So this is a helpful illustration to revisit the point that food security and insecurity rates prior to a disaster event. If an individual prior to an event classified themselves as having low food security, you can see how a disaster could easily drop that person down to very low food security. People kind of living on that cusp of food insecure may be pushed into food insecurity due to a disaster. So food access, food deserts, and food swamps are other terms surrounding food insecurity that you might have heard before. So let's take a look at food access. So food access specifically looks at the distance an individual or family lives from a supermarket or a grocery store. It also takes into consideration whether or not a vehicle is available to them to get to the grocery store. During a disaster, it might not be an option to visit the grocery store for a variety of reasons. Lack of transportation, grocery stores might be wiped clean, or even the grocery store is destroyed. So food deserts, on the other hand, are areas within a region or community that have a higher number of households with lower incomes and low access to supermarkets, supercenters, or large grocery stores. And then we have food swamps, which are areas where there is an abundance of fast food or junk food outlets or convenience stores, liquor stores, where they outnumber the amount of healthy food options in a community. So just think to yourself, think about your community right now. Do you think your community fits into any of these terms? Do you think that you perhaps live in a food desert or maybe even a food swamp? And then think to yourself, like, how might this impact a disaster plan moving forward? So for an example, if you're living in a food desert during a disaster, where would you go to access food? Do you know where the local pantries are? Would you utilize your neighbors as a resource? Would you rely on community organizations for assistance? So let's take a look at some timely data and see how food insecurity has been impacted due to COVID-19. A report released by the USDA before the pandemic says that roughly 35 million people, including 11 million children, were food insecure. So if we take a look at the chart, this is the lowest food insecurity rate prior to the 2008 recession. But all of those improvements were unfortunately upended by the pandemic. So it's COVID-19 pandemic resulted in millions of folks losing their jobs or experiencing a decline in hours worked. So looking ahead at 2020, it was projected that 45 million people, including 15 million children, may have experienced food insecurity as a result from the pandemic. So we see that spike hit in 2020. And then for 2021, those numbers were projected to be 42 million people, including 13 million children. So slightly better than 2020, but still 7 million more people are food insecure prior to COVID-19 in 2019. So we bounced back slightly in 2021, but we are still quite a ways away from where we were to pre-COVID times. And then due to the expiration of universal meal waivers, child food insecurity is expected to increase as well. So it's important that we discuss the role race plays in food insecurity. So according to a Map the Meal Gap report by the USDA, throughout history, people of color in the United States have experienced discrimination and maltreatment when it comes to education, employment, housing, and access to food and healthcare, and mass incarceration. So because of this, these marginalized communities have dealt with poverty and food insecurity at a much higher rate. So during the COVID-19 crisis, rates of food insecurity among Black households with children are nearly twice as high as they are among white households with children. And then rates for Hispanic respondents are 60% higher than they are among whites. So there are tools that exist to help us learn more about food insecurity in our nation, in our state, and even down to our counties that we live in. So Feeding America is its Map the Meal Gap tool is a great resource to help us gain a better to better understand food insecurity in our local area. So if you visit the website, you can just type in Feeding America Map the Meal Gap, and it will pop up in your browser. And you can enter your zip code from there and kind of look up your county. So you'll notice that there's a section on the website that shows the difference between the number of people who are food insecure versus the number of people who qualify for those federal nutrition assistance programs. So people that fall into this gap are likely some of the people that need to rely on food pantries because they don't have any additional funds to help their family purchase food. We can assume that the number of folks who fall in the percentage has likely increased due to recent inflation and cost of living due to COVID-19. So longer term disasters and their effects can alter the way we look at the changing face of hunger. So we have discussed how oftentimes hunger relief programs provide foods that are, shelf stable and can be limited in providing perishable foods to the affected populations. Provided foods tend to be prepackaged and can be high in saturated fats, added sugar, and sodium, and lack those vitamins and nutrients that we're looking for. They lack the whole grains, lean proteins, low fat dairy, and fresh produce. So this can lead our hungry neighbors to appear overfed, but in reality, they're really undernourished. They're not getting those key nutrients in their diets to allow them to live that healthy, active lifestyle. So this visual highlights the negative effects of food insecurity on adults. Lack of food security can cause a decrease in diet quality and eating behaviors and lead to chronic diseases like heart disease, high blood pressure, and diabetes, which can then in turn affect medical costs and decreases employability. And then that leads to a decrease in household income and can cause us to make difficult trade-offs to be able to live day to day. So perhaps the family is already food insecure and is making those difficult trade-off decisions. So maybe they're trying to make the decision of, should I buy a prescription that I need, or buy food for your family, making those tough decisions. So when we're thinking about disasters, a disaster event could exacerbate the cycle and add another layer of stress to an already stressful situation and lack of food security. So there's a lot of research showing a strong link between food insecurity and poor child health and behavioral outcomes. So unfortunately, children are more susceptible to the negative effects of food insecurity, as food insecurity is an obstacle that threatens critical foundation for children, especially from the ages of 0 to 3, where that brain development is really taking shape and taking place. Prolonged food insecurity due to a disaster or other traumatic event or series of events can affect children's health and can lead to a variety of health implications, including things like anemia, asthma, poor dental health, stunted development, and can even cause hospitalization if severe enough. Children who are food insecure can also have educational delays, including falling behind at school, having lower reading and math scores, missing school, visiting the school nurse due to the effects of food insecurity. They're having those hunger pains and they're not able to alleviate that pain. So, I'm going to go visit the school nurse because I don't feel good. And then in addition, children who are food insecure are more likely to show behavior problems, including hyperactivity, aggression, and anxiety. So compounding the stress and trauma associated with a disaster, these can have lasting impacts on children. All right, so shifting gears a little bit. Lastly, we are going to look at some resources that exist to assist in locating and accessing foods during a disaster, or if you or someone you know needs help accessing food. So as mentioned earlier in the presentation, the first line defense against food insecurity in the US are federal food programs such as SNAP, which is the Supplemental Nutrition Assistance Program, and WIC, which is Women, Infants, and Children. So these programs are helpful in providing families with food dollars or food items during a time of need. And during a disaster, the USDA, which assist disaster relief organizations and hunger relief organizations like food banks. They can provide assist in providing stockpiles of food. And then in addition, the USDA can launch the Disaster Supplemental Nutrition Assistance Program, or DSNAP, which gives food assistance to low-income households with food loss or damage caused by a natural disaster. So for DSNAP to come into effect, a state must receive an individual assistance declaration from the president and receive approval from the USDA. And DSNAP operates under different standards than SNAP. So in the event of a disaster, if offered, you can qualify if you have home or business repairs, temporary shelter expenses, disaster-related injury or funeral expenses, loss of home or loss of income due to a disaster, and even loss of food to a disaster. Consider looking at those kind of parameters and seeing if you qualify. So this is a great resource, disasterassistance.gov. Their mission is to provide disaster survivors with information, support services, and really just a means to access and apply for disaster assistance. This through partnerships and efforts between federal, state, local, and private sector partners. So once you visit their website, you're able to enter your information. It's kind of, when you click that, you can see it's highlighted, the Get Assistance. It's kind of like a questionnaire. And you can click which which answer applies to you and what you're going through at the time. And then at the end, once you're done filling out the questionnaire, you move over to the tab 2, which says Get Results. And there's a list of programs that are that you could fall under, and then you can apply for those also through disasterassistance.gov. And then I just wanted to note that the services and programs available can be for widespread disasters, such as things like a natural disaster that destroys a town, or it can be based on an individual. For example, if your home or place of business is affected by a fire, you can go through this questionnaire and kind of see what things or programs you can apply for. So we discussed Feeding Illinois and how they assist during disaster events earlier in the presentation. Feeding Illinois is also a helpful resource when searching for food throughout the state. Their website has each of the food banks listed and linked. And then from there, you can visit the food bank's website nearest to you or whose service area you fall under. And then kind of see what their partner agencies are and where you can access food in your community. So this map's pretty nice. You can find your county if you live in Illinois and see where the nearest food bank to you is located. All right, so the University of Illinois Extension SNAP Ed program has launched a community food map for the state of Illinois that allows folks to search by zip code or city for food resources. The Find Food Illinois Community Food Map connects individuals and families who need food to local resources without having to navigate through several websites for information. It's all in one map. The map shows the locations of stores, farmers markets, roadside farm stands that accept SNAP or WIC, food pantries, mobile markets, school meal sites, summer meal sites, senior food resources, and places where you can go to sign up for SNAP or WIC benefits. And then one strength in the map is that it supports submissions from people in the community to add, and you can edit the information displayed. So if I was I typed in my zip code and I found a pantry and I noticed that the hours aren't correct or accurate on the map, you can offer to submit a change on the map, and then you can add the information as to their, the more correct hours. And then those are received and reviewed, and then those will be added back to the map and updated to help folks who are also utilizing the tool. So this is where the map can be found. It can be found on the Illinois Extension's Eat, Move, Save website on the toolbar on the top of the page. And then also if you scroll to the bottom of the homepage, you can find it there as well. All right, and then with that, that is my time for today.
Wow, thank you so much, Taylor. I always learn a lot from each of these sessions. So thank you for all the great information that you provided on food resources during a disaster. So coming up next week, Emily is going to cover tree management before and after disasters. If you haven't registered for the series, please do so at go.illinois.edu/be prepared. I will put that in the chat as well too. Tell a friend. So much great information that's covered. Taylor also has a short survey, so I will put that in the chat box as well. And if you have like a few minutes to fill that out for us, we would greatly appreciate that. Just fill out that with information on how we can improve like our programs for future use. I will put that in there in the chat. And that concludes today's presentation. We know that some people might have to hop off a little bit early, but if you would like to stay back and ask us questions, we will be online for a little while yet. So thank you so much again for participating today. All right, I shared the link to the survey in the chat. Please grab that and fill that out for us. Thank you so much. I'm going to stop the recording. And if there are any questions, we'll stay on again for a few minutes. So Taylor, you let me know when.
Sounds good. Thanks, Kamaya.